One last thing, guys, that we need to talk about is glycemic control. We said that an instant blood sugar check cannot tell you about the control of the diabetes or not. You cannot. It doesn't give you enough. Doesn't have enough information because it's instant. It just tells you about what is happening now with the blood sugar. So it can help you to diagnose your emergencies. It's good for diagnosing either a simple hyperglycemia, a DKA, or a hyperglycemic hyperosmolar state, or even a hypoglycemia. It's good for that. But for control, we talk about HbA1c. And what is the target? The target, it varies with different patients. So when you've got someone who's got type 1 diabetes, their target should be at least less than 6.5. That's type 1 diabetes. For someone who's pregnant, you want for pregnant women, you want it to be at least less than a 6. Less than a 6 for someone who's pregnant. Because remember, you don't want that microsomic baby that might even be missing some limbs and all of that. So, and then for the elderly, or someone who's taking a lot of medication or a lot of comorbidities, at least you want it to be less than 8. Your target is less than 8 at least. And also for someone who's got a short life expectancy, maybe their life expectancy has been reduced, so you don't want to really push it really down, so you might give them 8. For a patient to maintain a blood sugar that has got a HbA1c that is less than 7, so general population, you want it to be at least less than 7. Some say 7.5, but anyway, it's fine. So 7 or 7.5 for the general population, because these are specific individuals. So when you want a good HbA1c, then if your fasting glucose should always be maintained between 4.5 to about 7. That's preprandial, but for postprandial should be less than 10 millimoles. So if you can do that, then you will achieve a good HbA1c. So that's it, guys. Okay, what happens when you've got a patient who has got some form of HB problems like hemoglobinopathies? Obviously you can't use HbA1c because the turnaround or the turnover of the red cells there is affected, or a patient who's got hemolytic diseases, so you can't use HbA1c. It's gonna be inaccurate. So there you depend on the instant blood sugars. Like I said, if you wanna control your HbA1c, try and make sure that your postprandial is less than a 10 and your preprandial is between 4 to 7. Okay, thanks, guys.